We're gonna talk about X-ray of sternum. Hello everyone, I'm علياء تكليف Hamza. I'm a second year student of Radiological Technique Department in Al-Zahraa University. This German scientist has found the X-ray. William Röntgen discovered them by accident in Europe on November 8, 1895. Although his discovery was an accident, he proceeded to study the X-ray so thoroughly that within a very short time he identified all the properties of X-ray that are recognized today. X-ray protection. The cathode is heated to cause the release of electrons. These are accelerated by high voltage toward the anode, which is positively charged. The whole process needs to be conducted within a high vacuum so the electron won't lose their energy by a molecule before they reach the anode. When the high energy electrons strike the anode, they release energy. Most of the energy is converted to heat, but some released as X-rays. X-ray interaction with the human body. When X-ray beams pass through the body and are absorbed in a different amount based on the density of the material they pass through. Dense material, such as bone and minerals, appear white on the X-ray image. The air inside the lung appears black. Fat or soft tissue and muscle appear in shade of gray. Anatomy of the sternum bone. The sternum or breastbone is directed anteriorly and inferiorly and is centered over the midline of the anterior thorax. A narrow flat bone about 6 inches or 15 centimeters in length. The sternum supports the clavicles at the superior manubrial angles and provide attachment to the costal cartilage of the first 7 pair of ribs at the lateral border. The sternum consists of 3 parts. The manubrium, that is superior portion of the sternum. The body is the longest part of the sternum, about 4 inches, and the xiphoid process. It is the distal and smallest part of the sternum. The radiographic position of the sternum. The routine position of the sternum include the AB oblique projection and lateral projection. They are the best position for sternum to show its detail on radiographic image. An orthostatic breathing technique generally is used to blur out the lung marking and the ribs overlying the sternum. If preferred, exposure can also be made on suspended expiration. A minimum SID for sternum radiography is 40 inches, about 100 centimeters. The patient's skin should be at least 38 centimeters below the surface of the collimator to reduce skin dose. Radiation risk. X-ray examination provides a significant benefit to patients as diagnostic tool, but the use of ionizing radiation also carries a small risk of causing harm. Threshold or deterministic effects occur only after prolonged or repeated X-ray exposure, giving doses in excess of 1 to 2 gray. Chest radiograph is about 0.2 to 1 milligray. That is below the range of the harmful exposure. It's recommended limiting lifetime diagnostic radiation exposure to 100 millisieverts. That is equal to 10,000 chest X-rays. Thank you for watching and goodbye.